The rain fell in steady sheets outside the city hospital. Drops raced down the tall glass windows, and the wind made the trees bend and shiver. Inside, the waiting room buzzed with quiet noise, sniffles, coughs, footsteps, and soft voices. People sat close together on hard chairs, holding tissues and looking tired. The smell of antiseptic floated in the air, mixing with the scent of wet coats. Nurses moved quickly between patients, checking charts and calling names. The front desk phone rang again and again, and no one had a moment to rest. It was a normal day at Westbridge General Hospital, where being busy was just part of life. Everyone knew Dr. Karen Blake. She walked through the halls in her white coat like she owned the place. Her black heels clicked sharply on the tile floor. Her hair was always perfect, tied back in a neat bun. Her face looked calm, but her eyes were sharp and cold. She was one of the best doctors in the hospital, smart, fast, and never afraid to make a hard call. But behind her back, some nurses whispered, "She's brilliant," one would say, "but she doesn't care about anyone. She doesn't even smile." Another would mutter. Still, no one could deny that Dr. Blake got the job done. She believed in facts, not feelings. Her patients were charts, symptoms, and test results. She didn't waste time on stories or excuses. But on this rainy morning, something was about to happen. Something that would challenge everything she thought she knew. About people, about pain, and about what it really means to care. The front doors of the hospital slid open with a soft whoosh, letting in a gust of cold air and the strong smell of rain. A man stepped inside, slowly and carefully, like each step hurt. His coat was torn and soaked through. Mud covered his pants, and his shoes had holes in them. His grey beard was long and messy, and his face was tired, worn down by time, and something deeper, something sad. People in the waiting room turned to look. A little boy pointed, and his mother quickly pulled his hand down. A few patients shifted in their seats, moving farther away. The nurses at the front desk exchanged looks. One of them wrinkled her nose. The man walked to the counter, coughing hard into his sleeve. His voice was rough and low. "I need a doctor," he said, almost in a whisper. The nurse looked unsure. "Do you have any ID? Insurance?" He shook his head. "Just need help. Chest hurts. Bad?" Another nurse walked off quickly and returned with Dr. Blake. She had been writing notes in a file, but looked up when she saw the man. Her eyes scanned him from head to toe. She didn't speak for a few seconds. "He doesn't have insurance," the nurse said quietly. Dr. Blake crossed her arms. "Send him to Mercy Free Clinic. We don't have time for charity cases today." "But he looks really sick," the nurse replied. Dr. Blake didn't even blink. "We have patients who scheduled appointments. People who actually follow the system. He'll be fine." The man didn't argue. He just stood there, coughing again. It was a deep, painful sound. More people stared now. One woman whispered to her friend, "Why is he even here?" Dr. Blake turned away and walked down the hall, her heels clicking again. No one noticed the way the man's hand shook as he tried to stay standing. No one cared that he looked like he might fall any second. At least, almost no one. From behind the desk, a young nurse stepped forward. Her name was Emily, and she had only been working at the hospital for a year. Her ponytail was starting to fall loose from the long shift, and there were dark circles under her eyes. Still, she looked at the man with real concern. "Sir," she said gently, "can you sit down for a moment? I'll get you some water." He nodded and slowly made his way to a nearby chair. Every movement looked like it took effort. He held his chest and winced as he sat. Emily turned and hurried after Dr. Blake, catching up with her near the nurse's station. "Dr. Blake," she called. Dr. Blake stopped and turned with a sigh. "Yes? I really think you should take a look at him," Emily said. "He's not just some guy off the street. He's sick, really sick." Dr. Blake raised an eyebrow. "Emily, we don't have room to treat every homeless person who walks in off the street. There's a process. But he might not make it if we send him away," Emily said, her voice firm now. "I've seen people like him before. He could have pneumonia, or worse." Dr. Blake stared at her for a moment. Her face didn't show any emotion, but something in her eyes flickered. Then she gave a short nod. "Fine. One quick exam. Just." To quiet the drama, Emily's shoulders relaxed a little, but her heart still raced. She wasn't sure why she cared so much. Maybe it was the way the man had looked at her. Like she was the first person in days who didn't treat him like garbage. Dr. Blake turned and walked toward the exam room without waiting for Emily. The man was already being helped in by another nurse. As the door closed behind them, no one knew that this exam would change everything. The exam room smelled like hand sanitizer and metal. The overhead lights buzzed faintly. The man sat hunched on the exam table, still coughing into his sleeve. His fingers were thin and shaking, his skin pale under the dirt. Dr. Blake entered, holding a clipboard. She didn't smile or say hello. Her voice was cool and professional. "Name?" she asked. The man cleared his throat. "Alan," he said. "Alan Pierce." She wrote it down. "Age, 62. She looked up briefly. "What are your symptoms?" "Cough, chest pain, dizzy sometimes." Dr. Blake listened to his breathing, checked his pulse, and asked a few more questions. The man answered slowly, but carefully. Then, just as she turned to leave, he spoke again. "You're misdiagnosing." Dr. Blake stopped mid-step. "Excuse me?" "It's not just a lung infection," he said quietly. "You're missing a heart murmur. Listen again. Lower left." She stared at him. "Are you a doctor now?" He gave a small, tired smile. "Used to be." Dr. Blake's lips pressed into a line. She placed the stethoscope back on his chest. Lower left this time. Her eyes narrowed. There was something off. "Lucky guess," she muttered. "No," he said calmly. "Not luck. Experience." Her face turned red. "Who do you think you are correcting me?" He didn't answer right away. Instead, he pointed to the dirty backpack sitting by the wall. "Check the front pocket." Annoyed, Dr. Blake walked over and unzipped it. Inside, beneath some papers and old gloves, was a framed document wrapped in a towel. She pulled it out and turned it over. It was a medical license. Her hand stopped moving. Dr. Alan H. Pierce, MD certified surgeon, graduated with honors, years long past, but real. She looked back at the man on the table, her mouth slightly open. He wasn't lying, and suddenly, Dr. Karen Blake didn't feel so smart anymore. Dr. Blake stared at the license in her hands, unable to look away. The gold seal was a little faded, but everything else was clear. His name, his photo, even the list of medical boards he had been part of. "This can't be real," she said softly. "I wish it wasn't," Dr. Pierce replied, coughing again. "But it is." Without another word, Dr. Blake left the exam room. Her steps were faster this time, heels clacking down the hallway. She didn't care who saw her now. She needed answers. She reached the hospital records room, logged into a computer, and typed his name, Alan H. Pierce. In seconds, articles, files, and awards appeared. He had once been a top surgeon, featured in magazines, praised for his skill, his steady hands, and his kindness. One headline read, "Dr. Pierce saves. 5 lives in one night." Another one caught her eye. "Tragedy strikes. Surgeon loses family in house fire." The article was short. A fire. His wife and daughter didn't make it. No known cause. After that, he vanished. Some believed he moved away. Others thought he took his life. No one imagined he'd become homeless. Dr. Blake sat back in the chair, stunned. How could someone go from saving lives to sleeping on sidewalks? She walked back slowly, the framed license still in her hands. Emily stood just outside the exam room, waiting nervously. "Was it real?" Emily asked. Dr. Blake nodded. Emily's eyes widened. "So he's really a doctor?" "He was," Dr. Blake said quietly. "One of the best." They stepped inside. Dr. Pierce sat with his hands folded, calm and quiet. "Why didn't you tell someone?" Emily asked. "I did," he said. "Years ago. No one believed me or cared." Dr. Blake walked closer. "You were one of the top surgeons in the country. What happened?" Dr. Pierce looked at her, eyes full of old pain. "My family was my reason. When they died, I couldn't face the world anymore. I left my job, my house, everything." He coughed again, and Emily brought him a cup of water. "I still remember everything," he added. "The body, how it works, how to heal it. But no one wants help from a man who smells like the street." Dr. Blake didn't know what to say. For the first time in years, she felt something she hadn't felt in a long time: shame. Dr. Blake stood still for a moment, the framed license still in her hands. Her fingers gripped the edges tightly, but her voice was softer now. "You should have been the one wearing this coat," she said, nodding toward her own white coat. Dr. Pierce gave a weak smile. "Once, maybe. A long time ago." She cleared her throat. "We need to run some tests. You're not just sick. You're in danger if we don't act fast." He nodded slowly. "You're the doctor now." Dr. Blake motioned for Emily to help her, and together they began treating Dr. Pierce properly. Chest x-rays, blood work, heart tests. As they worked, something changed in the room. The cold feeling was gone. It was quiet, but not tense. Respect had replaced the awkward silence. As Emily wrapped a cuff around his arm to check his blood pressure, she asked, "Do you ever think about coming back? Medicine, I mean?" Dr. Pierce chuckled softly, then winced. "You don't just walk back into the world after falling out of it, especially not looking like me." Dr. Blake looked up from the chart. "But your mind is still sharp. You caught things I didn't." He shrugged. "I read sometimes. Listen to podcasts. It helps me stay close to it, even if I'm far away." For the first time, Dr. Blake didn't see a homeless man. She saw a teacher, a doctor, a broken man, yes, but one who still carried wisdom and grace. "You saved lives," she said, "and then the world forgot you." Dr. Pierce gave a slow nod. "It's easy to forget people when they're quiet and dirty." Her throat tightened. "I almost turned you away," she whispered. "But you didn't," he said, meeting her eyes. She looked away, ashamed again. It was clear now. This wasn't just about one man. This was about everyone like him, tossed aside and unseen. And for the first time in her career, Dr. Blake began to wonder how many other brilliant minds, kind hearts, and broken souls she had missed, simply because they didn't look the part. Dr. Blake sat beside Dr. Pierce's hospital bed. Later that night, most of the staff had gone home, and the halls were quiet. A soft rain tapped against the windows again. The storm hadn't stopped, but something inside her had. She looked at the older man resting. an oxygen tube in his nose, and a blanket over his thin body. He was asleep now, breathing slow and steady. Beside her, Emily sat in a chair, holding the letter Dr. Pierce had written earlier. He said I could read it, Emily said softly. Dr. Blake nodded, and Emily unfolded the paper. It was written in neat, careful handwriting. To the ones who finally saw me. Thank you for treating me like a person today. You didn't fix everything, but you reminded me of something I forgot. Kindness still exists. Emily blinked fast and folded the letter again. Dr. Blake looked over at her. You were the only one who stood up. You saw him before I did. Emily shrugged. I just couldn't ignore him. Not when he looked like he needed someone. Dr. Blake was quiet for a long moment. I used to care more. I think over time, I just stopped letting people in. Felt easier that way. You mean safer, Emily said gently. Dr. Blake gave a small smile. Yeah, safer. The next morning, Dr. Pierce woke up stronger. The antibiotics were working. His color had returned, and he sat up without help. When Dr. Blake came to check on him, she asked, What will you do now? I'm not sure, he replied. I don't need much, just a warm place. Maybe a quiet job, something small. I can help with that, she said. If you'll let me. He nodded slowly, eyes soft. That would be nice. Emily smiled from the doorway. We'll make sure you're not invisible anymore. Dr. Pierce looked at both of them. One young, full of hope. The other older, finally remembering what hope felt like. He didn't say thank you again. He didn't. Need to. They already knew. A few days later, the sky was clear again. The rain had finally stopped, and the air smelled fresh, like new beginnings. Dr. Pierce stood at the hospital entrance, dressed in clean clothes that Emily had brought from a local shelter. His hair was trimmed, and someone had helped shave his beard. He looked different now, still older, still tired, but more himself, less like a ghost. Dr. Blake and Emily came to see him off. A ride was waiting to take him to a small recovery home across town. It wasn't much, but it was warm, safe, and full of kind people. Dr. Blake handed him a small envelope. There's a letter of recommendation inside, in case you ever want to help again. Teach, maybe. Dr. Pierce took it carefully. His hands, steady now. Thank you, he said. For seeing me, she nodded. For what it's worth. I'm sorry. For how I treated you. For not listening sooner. I've been ignored by better people, he said with a half smile. But you changed. That's what matters. Emily gave him a quick hug. You better write to us, or come back, even if it's just for coffee. I'll try, he said, stepping into the car. As the door closed and the car pulled away, Dr. Blake looked down. In her hands was a folded note. He had left it on the chair before leaving. She opened it. We are more than what the world sees. Some of us just get lost for a while. She folded the note and placed it in her coat pocket. From that day on, things changed. Dr. Blake smiled more. She listened longer. She taught the younger staff to look closer, to ask, to care. And though Dr. Pierce never came back to the hospital, his story stayed there forever. Not as a warning, but as a reminder. Everyone has a story. And sometimes even the forgotten can teach the greatest lessons.